All right. Hello, everyone. Welcome back to the channel. Ooh, I am so excited today because we have a special guest on today's episode. So, Dr. Shadi Haddad has been here. He is actually we share a very intimate relationship.
Oh,
Intimate. Whoa, that's a little weird. Well, basically, we went to PT school together, and Shadi has been one of those students who have just been very focused, very intelligent, scoring well on his grades. You have any advice or questions on the exams or kind of like how they would approach these things? Shadi is your guy. So right now, I'm gonna let him take the floor in a bit. But basically, Shadi is working as a full-time PT. His specialist is in chronic pain. So as a chronic pain PT specialist, he's doing so many cool things. And I'm just super excited for him to work or talk to you guys here today. So everybody give a warm welcome to Dr. Shadi Haddad.
hey everyone. So I'm Dr. Shadi Hada, DPT, TPS, CSCS. You've probably heard of DPT and CSCS, but the TPS is the weird one in there. So a TPS is a therapeutic pain specialist, and I received that after completing a program with Evidence in Motion. Last year, I actually started in July 2021, finished Christmas Day last year. So pretty cool. And there are only 800 TPS doctors in the entire United States.
Wow.
And so I became one of the 800 and the only one in my city of Santa Clarita. So yeah, treating a lot of chronic pain patients, a lot of patients who have a lot of questions and haven't had much success with treatments over the years. And here we are being able to provide some hope. And a lot of this is very novel. It's very new. A lot of the main research has come out in like the last, I would say 3 to 4 years. Really from 2019 was the kind of when they made the breakthrough. So pretty cool.
Yeah, and thank you for your service and just like taking the dive in this chronic pain realm because as you know, it's intense. It can have its insights and ins and outs. But yeah, I was just wondering, how did you end up going into chronic pain?
It's a great question. So we were in PT school several years ago. It's been many years now.
Can you believe it?
We're already in our third year as doctors. But
Right.
we were entering our third and final year, and we had our chronic pain class. And I struggled a lot in PT school, but this was the one class that I was excelling quite a bit in, and I noticed like my peers were struggling as well. But I was like, this makes total sense. Like this is my thing, and I found out that not a lot of people want to work with this patient population, and I thought, well, then I'll do it. And prior to PT school, my plan was to apply to go to the seminary and become a biblical counselor. And I started seeing in our class, obviously I got into PT school, so did that instead. But I saw in our class there was a lot of like, oh, there's an element of counseling involved in treating these patients. A lot of communication skills are very necessary. A lot of empathy, a lot of understanding and conversation that needs to take place for them to understand what's going on and how to get better and that they're going to be okay. So that kind of planted the seed for me to want to do chronic pain down the line. And then I saw there was this program. And so it was led by Adrian Lowe and his wife, Colleen. So she served as the director of the program. And it was 6 months of intense training and how to treat this population group that severely has been mistreated and untreated.
Tell me about that. What could you elaborate a little bit more on like mistreated or untreated?
Right. Yeah, that's a great follow-up. So oftentimes people who have been having pain for 5 years, 10 years, or even just a few months, first thing that happens is when they go to see their doctor, oh, here's some pain medication and maybe go try some traditional physical therapy. And usually they go through the traditional route of the general PT. Oh, let's stretch this, let's strengthen this. And it doesn't tend to solve the problem. They may get a small fix of the pain medication helping temporarily, but it eventually turns into an addiction. And these pain medications are only meant to be taken for a short period of time. Like even when someone gets surgery, it's only given in small doses for maybe 2 weeks tops. And so these people have end up taking this pain medication for months and then years.
Mm.
And so when they start developing a tolerance to the medication, oh, we'll just give them the next strongest medication. And all these pain management physicians out there, I believe in earnest they're trying to help people, but they're going about it the wrong way. This is not just a biological problem. It's actually a biopsychosocial problem. And so when they come in,
say it, brother.
when they come in, so I'm often asking like, hey, well, how long have you had this pain? Oh, I've had it for, 10 years. Okay. Down the road in our, evaluation, I'm going to explain to them, well, hey, tissues actually heal themselves within 3 to 6 months.
Mm.
And so it doesn't explain why the pain goes away, or why the pain is still there, rather. But we need to at least explain to them like, hey, no, like it's not broken, it's not still fractured, it's not still torn. We can rehabilitate this, because the body has a great way of healing itself. Just even when you get a paper cut, you notice like over a couple of days, oh, it's healing itself, with time, and it's good to go.
Yeah.
So when they come in and they've been mistreated or misdiagnosed as, oh, it's just a general injury, really it's something deeper inside. So I often ask other questions that we call yellow flags. So, hey, what was happening in your life around the time that you had this injury? Oh, it was in the winter and I was going through, my parent, she died, or someone's going through cancer and it was really stressful. Okay, that's relevant information, because sometimes they'll say, oh yeah, my pain always tends to get worse around the winter, or whenever, if we have a family reunion, it tends to get a little bit worse. It starts to flare up a little bit. I'll ask them, well, how's things at work? Is work causing you extra stress? How are your finances? Is there any financial stress? Have you seen, more than 2 or 3 or 4 doctors trying to figure this out and they just can't figure it out, or, multiple failed treatments? So all these things together combine to be this conglomeration of yellow flags that tend to affect them. So I say to them like, hey, look, these yellow flags that I'm asking you about, these are things outside of you that tend to affect you physically. And then we really start off with just a basic understanding of like, okay, these things are also impacting me, not just how I feel inside.
Gotcha. Wow, that's mind blowing, and I'm sure those who are listening right here, it's like, wait, you're probably wondering, okay, so that's crazy. So the follow-up question to you, Shadi, is how do these questions relate to you as a physical therapist? Like, how do you implement physical therapy treatments, which most of us know as manual therapy, exercise, and whatnot? How does all of this play together?
Right. So when they come in and we determine, okay, this is now a patient who we can put in the chronic pain category, right? Where tissues have healed, like, okay, they've done x-rays, MRIs, everything looks normal. They're still having a lot of pain. There may be a pain medication prescription also ongoing.
So
Then,
just to clarify, so basically they're in the chronic pain category when we are confident that the tissue itself has actually healed, like it's been way too much time. There's nothing really mechanically that we're able to change with their pain. So something else is going on here.
Correct.
Okay, gotcha.
At that point, everything is on the table. So we may not necessarily just do traditional PT interventions like manual therapy, which is still okay to do. In PT school, you guys will learn about joint mobilizations and that the first 2 grades are for pain relief. That's still viable to use for these chronic pain patients. And something that we learned in PT school from our great professor, Dr. Wong, he said, never underestimate the effect of a therapist's touch.
Yeah, that's right. You're absolutely right.
So hands-on therapy is good. It's definitely good, but you don't want to do an over-reliance on it. So eventually, because we want to build these patients up to be, have a lot of self-efficacy and independence. So something that you'll often find with these patients is that it's gotten to the point where they can't even determine right and left, or sometimes limbs will feel bigger than they actually are, and they tend to bump it all the time. So that's a common thing you'll see with a CRPS, which is a chronic pain condition you guys will learn in PT school. So when a patient comes in, I try to find out goals. Goals are the most important things. So oftentimes there'll be the 6 pillars, we call it, of chronic pain treatment. We mentioned pain education, explaining how tissues are healed. Second thing we want to talk about is sleep hygiene. If you can't sleep, you can't recover. So we have this big fancy sleep hygiene checklist that the program provided us. And I have them go through it like, okay, so I want you to check the things that you are doing and circle the things that you're not doing. And each week we're going to tackle one of these to help you get sleep, because they've been proven through the research that, these things actually tend to help with sleep quality. So
Right.
I actually had someone about a year ago who, lady in her 50s, hasn't had a full night's sleep in maybe 40 years. And we went through this, and about 4 weeks later, she's like, I'm having full night's sleep. My marriage is better, and things are great. So we're helping change lives. So it's pretty cool.
Nice.
So sleep
Yeah.
hygiene. Another one is aerobic exercise. So
Mm,
I kind of explain to them like, hey, when you work out and you feel like really invincible afterwards because all the blood's pumping, the adrenaline's pumping, everything's going on. You feel like you can take on anything. You feel invincible. Like, yeah, like, okay, well, that's something called endogenous analgesia. And that's a big fancy word for just saying within myself, the absence of pain. And we want to
mm,
produce that, but we want to do it through gentle aerobic exercise because it produces that even at a gentle pace. So I
mm,
want them to be moving. Movement is medicine. Oftentimes, these chronic pain patients are people who've either been through work injuries of construction and just never took time off, or
mhm.
people who are confined to a desk for hours and hours a
Yes.
day.
Sedentary.
Sedentary, yeah.
Yeah.
So those three so far, and then coping skills. What are you doing to de-stress? Are you just working all day? What is your day filled
Mm,
with? So we need to find something to have a de-stressor, something to cope with the symptoms while you still have them.
yeah.
The fifth one is social interactions. So how are your
Oh, wow.
relationships? How are things, like I mentioned, so financial stress, job stress, but also relational stress. And how I mentioned
Mm,
like how oh yeah, your mom was passing away from cancer, something along
hmm.
those lines. So having that good social circle, not a social network, a social circle.
Or social media.
Yeah, yeah, of people to have it as a support system is very important. And then that last one I mentioned was goal settings. Um,
Gotcha.
so I tell them, look, if we don't have goals, this is just going to be a bunch of dumb exercises that we're just doing for no reason. So we
Mm,
have to have a
wow.
reason why we're doing things. What are we working towards? Because you're not in here because you're in pain. You're in here because pain is getting in the way of something that you want to do, something that's important to you. So we need to
Mm,
have a long-term goal that we're going to work towards and then build up to that.
nice. Shadi, I really love that. You take chronic pain where it's this like ambiguous thing, and then you break it down into like these six pillars. So it gives some clarity. And even like as a patient, I'd be like, whoa, okay, all right, I gotta knock this world, this pillar, this pillar. And then once I can totally see how once those pillars get better, my quality of life can also improve as well. So that's really cool.
Absolutely. Absolutely. Yeah.
Nice. So tell me about like your clinical setting. Tell me about your work life. What's a typical day look like for you? Those who are listening have no idea what clinical setting you're at. You can kind of start there and then move from there.
Sure, I may be labeled as one of the enemies after this or that a sellout, but I think this is a great way for us to kind of reshape our thinking about healthcare and the industry in general and outpatient practices. So I work as a physical therapist, as we mentioned, but I work in a medical conglomerate in Santa Clarita. It's called Unruh Spine Centers. And our CEO is Dr. Chase Unruh. He is a chiropractor. That's right, a chiropractor. And
Oh my gosh.
he has a team of chiropractors, and he decided to expand his business several years ago by having other medical disciplines by saying, hey, look, we should not be in competition with one another. We should be working together. So I'm like one of the Avengers here in Santa Clarita of healthcare.
Which Avenger?
We'll probably go with Spider-Man because I'm the smallest one.
Oh, there you go. Peter Parker. Let's go.
So So yeah, we're a bunch of doctors all working together, and we get to have, in an outpatient setting, because you don't get to have this usually in an outpatient setting, but we get to have interdisciplinary team meetings about patients that we all
Mm,
share. Usually you hear that in an inpatient setting for a
that's so
hospital, like,
cool.
hey, we're gonna do our rounds and talk about this patient. But I'm often talking with the chiropractor I mainly work with, and our acupuncturist and our podiatrists, massage therapists, and we're constantly referring to one another. Hey, tackle this
Mm,
one so I can tackle this. If I'm having a hard time with somebody who's just, man, this muscle is just so tight and I don't want to do massage. Okay, I want you to go to our massage therapist for, a session or two and then come on back. Oh my goodness, we have all this range of motion. It's back. So
so
we're
it's
all,
very common for a patient to kind of bounce through as needed.
yeah, bounce around. And then oftentimes they kind of get
Wow.
a nice, like a sum of all of us. So oftentimes
Yeah.
someone will come and get their chiropractic adjustment, and then they'll come and see me for physical therapy right afterwards. Like, oh, they're nice and
Mm,
relaxed. They're a little bit looser, makes our
hmm.
jobs a lot easier, less manual therapy we have to do.
Sure.
So it's very efficient.
Nice. Yeah, I know. Yeah, I could definitely see that.
Yeah. So a typical day for me, I'll wake up and I'll round up my kids, feed them breakfast, get them going, and then I'll take off to work. And we usually work from 9 to about 12:30. So it's a fast-paced 3.5 hours. And then we come back at 3 o'clock for another fast-paced 3 hours till 6,
Mm.
and rinse repeat for 5 days a week.
Crazy. And you mentioned, and we were chatting a little bit before this, you mentioned you have about 15, 30-minute slots per patient. So like per hour, how many patients are you seeing?
We see about 4 patients an hour for physical therapy.
That
And that's
is
very
crazy.
different. It's very different from
Yeah.
most clinics. Usually some people get an hour, some people get half an hour. We're very different that we have 15-minute sessions.
Mhm.
And part of that, there's an expectation of accountability. Like, okay, I'm going to help you out here, set you up for success. I'm going to show you what to do, how to do it right. And then you need to go do it and come back. If a patient hasn't done their quote unquote homework,
Mhm.
then we're kind of wasting our time.
Yeah.
So we find this model actually helps a lot with patient recovery because, well, they have to do the work themselves. The home
Mm.
exercise program is no longer hypothetical.
Yeah. It's a necessity.
It's a necessity. It's essential as part of the program. Yeah.
Wow, that's cool. Yeah, it sounds like your work environment or like the business model per se is really intentional and really just centers around the success of the patient. Like you're doing everything you can, giving every single resource possible to make sure that the patient can feel heard, known, and addressed with everything that they're going through.
Yeah, and we're honestly we're serving this need that we found with a lot of patients, and I'm sure you'll experience this in your life as we get older and we get hurt, and we see multiple doctors. But we live in Santa Clarita over here, and it is a lot of traffic. There's 150,000 people in this
Mm,
little city, and it's just growing. And there's a lot of traffic. It's a lot of time commitment to go from one place to the next place. What
yeah.
we're doing is we're saying, hey, everything's under one roof. You only have to go to one place, and we're all
Mm,
here. Versus I got to go to this doctor at 3 o'clock, and then I go back here, at 5:30, and it takes up your whole day. Versus, oh, I can
right.
commit an hour, an hour
Yeah.
if I can see a couple of doctors. We're all here. So
Yeah.
very nice.
Efficiency. I love it. Tell me about some pros and cons of your field specifically. Oh, oh no. Can you hear me? I think your audio might have gone out. Um, can you hear me, Shadi? Hello, 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 hello. No? Go to your on the bottom left, it says mute, press that button and then press like built-in microphone or something. Maybe we can use your laptop. I don't know if maybe your Bluetooth connection got funky.
Can you hear me now?
Oh, now I can hear you.
There we go.
There we
Okay.
go. That was weird. I guess your headphones don't like the pros and cons question.
What was your question?
A question to you was, what are some pros and cons of this field, specifically in the chronic pain category? And thank you for being flexible with the software stuff.
Sure, sure, sure.
Yeah.
Pros and cons of chronic pain. So the
Mm,
pros are that it's very rewarding when a patient finally
mm,
makes a breakthrough. You get to
mm,
see someone say like, "Oh man, my life is so much different," or "You helped me take my life back," or "I'm able to do this again. I didn't think I could ever do this again." And that part is just it makes the job worth it.
mm.
The cons is that this is a very intense population group. People come in,
Yeah.
they're often angry. You'll get a lot of crying, so have the tissue box ready. You have to ask a lot of hard questions and have them open up. And for me, I've just been blessed with this ability to really just develop trust with the patient and develop rapport. But a con can be that you really have to have good communication skills. And so if you can't get that patient to trust you, if you can't get them to open up, you're gonna hit a brick wall. And
Mm,
so it's I think there's a reason why there aren't that many chronic pain certified specialists out there. But yeah, you have to be
mm.
careful that when you come home, you're not bringing home that those depressing feelings with you. You know,
Oh,
um, so you have to really compartmentalize.
yeah,
Um,
yeah.
but yeah, it's hard not to get attached to these patients who you will spend so much time with. You trying to help them, and I have to say, another con of this is that you're not always going to be successful. In
Mm,
physical therapy, you're trained for success.
right.
Here, this is still very new. How to treat chronic pain patients is still very new, but we're finding success here. It doesn't mean we're going to hit it out of the park every single time, but we're celebrating like, oh, we're able to help, a huge portion of people who used to be in pain, and maybe we haven't learned how to help the other portion, but we have something here. Doesn't
Yeah.
mean you're not going to run into those people that you can't help though.
Right.
And another huge challenge and
Mm,
hurdle with chronic pain patients is that they have to want to get better. They have to be willing to put the work in.
mm,
I'll
that's
be,
tough.
yeah, I'll be treating or evaluating a lot of patients and they'll say, yeah, man, I can't take this anymore. I'm like, okay, I can help you. And I explain to them, what we're going to do and what it's going to be like. And some of them don't come back.
Mm,
Sometimes I would say maybe a third to 40% don't come back
wow.
because they either think, oh, this is hokey,
Hmm.
or this is not what I need, or some patients they just don't want to work. And
Yeah.
physical therapy, it's in the word physical. You have to be, it's very interactive, you know.
Yes, indeed.
So it's not
It's
a
not just a
passive thing.
pill. You're telling me it's not just a pill or injection where it
No, it's not
gets
a
me better?
it's not a quick fix. There is no quick fixes with chronic pain. Think about it, like I always tell them this, like, look, if it took 10 years to get to this point, it's gonna take a
Mm,
lot more than, a session or two to help you get back to where you were.
yeah.
So
Yeah, and speaking of, so in chronic pain specifically, or I guess like patients that you see, how long average would you see these patients for?
you asked the worst question. Because yeah, there's no timetable. That's the frustrating
Yeah.
part about this. There's no timetable. But
Hmm.
that does lead to something very important. So
Mm,
a huge thing they found with chronic pain patients was, again, we mentioned the biopsychosocial factors.
right.
So a lot of it comes down to a belief. What do you believe about your condition? What do you believe this is going to do to you? What do you believe about how this has impacted you or how it's going to limit you? So, and a good question to ask was like, well, where do you see yourself in 5 years if this doesn't go away? And,
Mm,
what would you do if this just went away? If I could snap my fingers and it goes away, what would you do? Oh man, I would do this. Great. So I have my goal right there that we can work on. But I also get a good
nice.
idea of like, yeah, I'm kind of scared. I'm gonna have in a wheelchair from this. Okay,
Yeah.
so we need to work with that and then find out, okay, well, if you believe this is going to work, you have to believe it's going to help you. Uh, you know, um, if you look actually at cervical manipulations, I think it was by Sung,
Mm,
Tseng. His criteria, one of the criteria for to do a cervical manipulation was, does the patient believe they're going to feel better? There's so much power in the placebo. I know there's like placebo has like all this baggage with like, oh, we think it's bad. It's not true change, but placebo is so powerful. In fact, we produce in our brains pain-killing um, chemicals that are 10 times stronger than the strongest opioid out there.
mm,
You
I
look,
believe
you
that.
you can look at all the even people who do these awesome physical feats of like, man, how do they do that? Like, and just sometimes it can come down to what does the
Mm,
brain believe about what they're doing right now? What does the brain believe about their condition right now? And it really produces, a lot of effort. I mean, think about it when you exercise. Oh man, like when the right song comes on, you're gonna go an
mhm.
extra 5 minutes. You're gonna do a couple extra reps, and it just produces something in you. And we see this, we feel it all the time.
Yep.
So
Yep.
those things definitely take impact. And so I kind of gauge out the timeline of how long it's going to take based on that. Some people, like I mentioned, the lady who couldn't sleep, she got better in 4 weeks. I thought, it might be 6 to 8 weeks, but she got better pretty quickly. Then I had one lady who, young lady in her 30s, sprained her ankle in February 2020, right? The pandemic begins in March 2020. She's laid off from work. She can't get access to a doctor. She comes into the
Mm,
clinic July 2021. It's been a year and a half. She's got a boot on, and we know
oh my,
tissues heal, right?
oh my
And
gosh.
she's like, I've done x-rays, I've done MRIs, they've shown my ankle's fine, but I'm still in tremendous pain, right? So we had 1 half-hour session right then and there on that
Yeah.
Thursday. She came back on a Tuesday, she was walking on the treadmill. The next Thursday,
Wow.
2 days later, she was running on the treadmill, and she
Wow.
was done. So
Wow.
it can be super short, it can be super long, and sometimes you have to strike a balance of like, is this actually helping or not? And again, it comes down to
Yeah.
belief. Do they believe they're
Yeah.
getting better? Do they believe in the treatment that we're doing here? And for those patients, sometimes they go away. So
Wow.
yeah, pros and cons all
Doc,
over.
Dr. Shadi's spit in the game. Man, this is some awesome stuff. I really appreciate you just sharing all your insight. And I'm loving how you're really shedding light on just as the different facet of physical therapy. I think most people just think of the manual physical things, and although you do that, but there's a huge aspect of like this psychosocial approach to what you're doing here. I mean, constantly you're always going back to either memory, how they perceive, how they believe. Like these are all things with the brain, not just like the physical touch. So I think that's really cool.
Right. And a huge thing you got to do with communication, make them laugh. So I'll
Mm,
often point out like, hey guys, look, I'm not angry. I just look angry all the time because I got these Middle Eastern eyebrows that are very stressed out, but I'm really not angry with you guys. But you got to make them laugh. If you can help them laugh, they can help them feel ease. Like they trust you as their
nice.
doctor. They trust you as their therapist. They believe they're going to get
Yeah,
better.
yeah,
So
you're absolutely right. All right, man, you're spitting some good nuggets, man. So Shadi, what kind of personality would make a good chronic pain specialist? Because I mean, like you said, like
mm,
it takes a special kind of person. It's
it
very
does.
niched. I could already probably think of patience, right? Maybe someone who's funny as well, a good sense of humor. But yeah, in your words, like if a student's thinking, I want to be a chronic pain specialist, would I be a good fit? What kind of personality would they need?
I think you have to go outside your comfort zone, first of all. Be comfortable going outside your comfort zone. Oh, I'm
Mm,
just an orthopedic therapist, that's not going to work in a chronic pain setting. Oh, I really just want to treat neurological conditions, that's not going to work in chronic pain. You have to consider every system as you're treating. So you have to have a good knowledge, good breadth of knowledge on all the systems as that comes together. I would say number two, you can't be closed-minded. Consider
mm,
all your options. Who's to say if they say, "Oh, I feel better when I do this," who are you to tell them that they don't feel better when they feel that?
yeah.
There's all this conflicting research on, ultrasound. Is it effective? Is it any better effective than a placebo? And then some people say, you know what, I just feel great when I hit the ultrasound. And I know it's lousy. I
Hmm.
know it's not going to do very much. I know it doesn't penetrate that deep into the tissues, but it helps them feel better and that they're more willing to do some exercises afterward. I'm going to have the technician do the ultrasound
Yeah.
before they come in. So be very open-minded, consider all options, and be willing to, like, you know what? I can't do this one, and refer out. Don't have the hero mentality of
Mm,
like, I'm Mr. Physical Therapist, I'm a super therapist, I'm going to help everybody get better. And sometimes you can't do it. So be willing
yeah.
to, accept when it's not working, or, have an open mind, be humble and consider other options, just consider everything. And I think that's what makes it really fun. You have to be very
Mm,
creative. You have to kind of find out, you have to be a motivator, help them get these goals, help, be a coach, be a friend, be a
yeah.
listener, be a good listener, be willing to just ask good questions and help guide them to not only what you need to find out about them, but help them kind of take the edge off and feel ease when they're around you. So
Yeah. Wow. Love that. Thank you for sharing that, Shadi. That's really good insight, especially for students who are considering this profession. So I had a couple more questions. So a lot of my subscribers, followers are students who are trying to get into PT school. And maybe as they're watching this, or maybe as they're getting ready to apply, a lot of them want to try to distinguish themselves. How would they stand out? So you, who's gone through the road and has gone through PT school and all and got accepted, when you were applying, what did you do to set yourself apart from other students?
yeah, good question. So I think a few things I want to consider was, okay, where do I come from? Okay, so I'm a Middle Eastern guy, first generation Arab American.
Mm,
In my
nice.
bloodline, it's very common for, people of Middle Eastern descent to have hypertension and have diabetes. And I've been very diligent and, for the better, more than half my life to be very active, be very fit, and reverse that trend. And so we
Mm,
had this essay in the PT cast that was, where how would you take the mantra of movement is medicine, for the next, 10 years for our profession. And I shared that story, like, look, you're not bound to your genetics, you're not bound to what, other conditions that, people in your family have had. Just because someone was an alcoholic doesn't mean you're going to be an alcoholic. Just because they had this condition doesn't mean you're going to have that condition. You can break the cycle. You can have agency. You can take control. So that was one thing I really highlighted in my response to that. But really find out, what is it that makes you you, and what do you have to offer this profession? You don't just say, oh, I want to help people. You can go
Yeah.
work at McDonald's and help people.
Yeah.
Go flip burgers. So I really like to ask, like, it's not why you want to be a physical therapist, it's what is your mission as a physical therapist? What are you hoping to achieve in the world? What are you hoping to achieve with your patients, with your population, with your life? What do you want to look back on 30, 40 years from now and see, like, man, that was what I did for a living and I made the world a better place. So find out something that's deeper than just, oh man, I really just want to help these people, or I really want to help athletes. Like, there's more to it than the athletes. There's the everyday person who just wants to be able to ride a bike again. There's the everyday person who just wants to be able to, man, if I could just get out of the house and walk around the block. And so
Nice.
yeah, that was a big thing for me when I was applying. I want to really highlight, like, I'm here on a mission. I'm not here to help people necessarily, just that's too simplistic. I'm here on a mission to help people's lives get better and take it back.
And probably when you applied, maybe like 5 years ago or so, here you are 5 years later on that mission, literally fulfilling that mission every single day when you go to work. Wow.
It's a mission for sure.
Well, Shadi, I really appreciate your time here today, and everything that you mentioned has given me a lot of insight, and I'm sure a lot of the people who are watching this video as well. Before you head out, is there any way that people can get in contact with you if they have any follow-up questions, maybe social media, email?
Right. So you can find me on Facebook, just as my name, Shadi Haddad, SHADI HADDAD. I'm on LinkedIn as well. But if you want to contact me through email, the best email is drhaddad@unruhspinecenter.com. That's UNRUHSPINECENTER.com. So Dr. Haddad at unruhspinecenter.com.
Awesome. Well, Shadi, I'm really appreciative of your time. And yeah, I'm so thankful that we had a chance to meet up again. I know you're a daddy of two, got a third one coming on, and I don't know
Indeed.
how you manage all of this.
Hey,
you do.
I'm also redefining dad bod as well.
Oh, let's go. Oh my gosh. You are not your genetics, right?
No, I'm not at all.
Oh my gosh. Well, it's been a pleasure, Shadi. I really appreciate your time, and I hope all the students who are watching this as well really gained a lot just as much as I have. Every day is a great day to lift weights, lift others, and lift yourself up. Lift for change, y'all.